Thank you for joining me. I'm Barbara O'Neill. Your nails are more than just a cosmetic feature. They're a window into your overall health. They're the last to grow back after illness or injury, making them a reliable indicator of your body's condition. With each passing day, your nails grow about 0.1 millimeters, reflecting the nutrients, circulation, and overall function of your body. Nails also contain nerves that send signals to the brain when they're touched or injured. This makes them an important sensory tool, even helping to gauge the severity of an injury. But beyond that, your nails can reveal underlying health issues. Conditions like psoriasis, diabetes, and kidney disease can all leave their mark. They may also hint at nutritional deficiencies, such as low levels of zinc, iron, or vitamin B12. In today's video, we'll explore some of the most telling signs your nails can give you about your health. But before we begin, I'd love to hear from you. Where are you watching from today? Drop a comment below and feel free to ask any questions. Now let's dive in. Number 1, yellow nails. Yellowing of the nails can have several causes, and one of the most common is a fungal infection known as onychomycosis. This occurs when fungal spores settle under the nail bed and begin to multiply, causing the nail to thicken, discolor, and become brittle over time. Left untreated, the infection can spread, making the nails increasingly difficult to manage. Smoking is another culprit, as nicotine stains the nails, turning them yellowish over time. Even frequent nail biting can contribute, as bacteria introduced from the mouth can alter the nail's natural color and weaken its structure. Number 2, white spots. White spots on the nails, often referred to as leukonychia, are usually harmless and result from minor trauma. Something as simple as bumping your nail against a surface can cause these marks to appear. However, in some cases, they can be a sign of nutritional deficiencies, particularly a lack of zinc or calcium. When the body is deficient in these minerals, the nail structure weakens, leading to tiny white spots or patches. In rarer instances, persistent white spots can indicate underlying conditions such as diabetes or kidney disease. An excess buildup of calcium in the body may also contribute, affecting not only the nails but other areas of the body as well. Number 3, brittle or cracked nails. As we age, our nails naturally become more fragile due to a decrease in keratin production, the protein responsible for their strength. However, if nails frequently crack or split, it could be more than just an aging issue. Dehydration plays a major role, as inadequate water intake leads to dryness and brittleness. Trauma, such as repeated exposure to harsh chemicals or excessive use of nail polish remover, can strip away the nail's protective layers, making them more prone to breakage. Thyroid imbalances, particularly hypothyroidism, can also contribute to brittle nails, as the condition slows down metabolic processes, including the production of proteins essential for nail strength. Certain medications, such as psoriasis treatments and antifungal drugs, may also alter the nail's composition, causing them to become more fragile. Number 4, discolored nails. Discoloration in the nails can sometimes indicate underlying health concerns. When blood vessels beneath the nail become inflamed due to injury, a purple or blue hue may appear. While minor bruising from trauma usually resolves on its own, persistent dark streaks under the nail bed should never be ignored, as they may signal melanoma, a dangerous form of skin cancer. Any unexplained or sudden changes in nail color should be evaluated by a healthcare professional to rule out serious conditions. Number 5, pitted nails. Small dents or pits in the nails are often associated with psoriasis, eczema, or other inflammatory skin conditions. When the body is dealing with chronic inflammation, the nail matrix, the tissue that produces new nail cells, can become disrupted, leading to uneven nail growth. Repeated exposure to harsh chemicals such as acetone-based nail polish removers can also weaken the nail structure over time, making them more susceptible to damage. Keeping the nails well nourished with natural oils like coconut or olive oil, along with minimizing exposure to irritants, can help restore their strength. Number 6, ridged nails. Ridges that develop across the nails can provide further clues about overall health. Vertical ridges are often harmless and become more noticeable with age as cell turnover slows. However, deep horizontal ridges, known as Bowes lines, may indicate an underlying health condition such as diabetes, severe stress, or nutritional deficiencies. Injury to the nail bed, particularly if it occurs repeatedly, can also lead to ridging. Additionally, chronic dryness and inadequate hydration can weaken the nail surface, making these ridges more prominent over time. Number 7, bluish nails. A bluish tint in the nails can be a sign of poor circulation or low oxygen levels in the blood. This can occur due to cold temperatures temporarily restricting blood flow to the fingers, but in some cases, it may point to more serious cardiovascular or respiratory issues. Conditions such as chronic obstructive pulmonary disease or certain heart disorders can lead to reduced oxygen delivery to the extremities, causing a blue or darkened appearance in the nails. In some instances, bruising under the nail from minor trauma can also cause temporary discoloration. If the nails remain bluish for prolonged periods without an obvious cause, it's important to seek medical evaluation. Number 8, nail biting. Nail biting is more than just a habit. It can have lasting effects on nail health. Often linked to stress and anxiety, chronic nail biting can introduce harmful bacteria and fungi into the nail bed, increasing the risk of infections. Over time, repeated biting damages the nail matrix, leading to irregular growth patterns or even permanent deformities. In addition to affecting nail health, frequent nail biting can weaken the immune system by exposing the body to bacteria from the hands and mouth. Breaking the habit not only improves the appearance of the nails, but also reduces the risk of developing infections and inflammation in the nail bed. Number 9, reddish nails. Reddish nails may not always be a cause for concern, but persistent redness, swelling, or tenderness could signal an underlying issue. Chronic nail trauma, such as repeated pressure on the nails from ill-fitting shoes or excessive use of manicure tools, can lead to inflammation and discoloration. Nutritional imbalances, particularly deficiencies in essential vitamins and minerals, may also contribute to reddish nails. Circulatory problems, such as high blood pressure or poor vascular health, can cause increased blood flow to the nail bed, giving them a more reddish hue than usual. If redness is accompanied by other symptoms like pain or swelling, it's important to assess overall health and make necessary dietary or lifestyle changes. Just like our skin, hair, and eyes, our nails reflect what's happening inside our bodies. Subtle changes in color, texture, or strength can often be the body's way of signaling a deeper issue. Ensuring a nutrient-rich diet, staying properly hydrated, and practicing mindful nail care can go a long way in keeping them strong and vibrant. If you notice persistent or unusual changes, it's worth paying attention. Your nails might just be telling you something important. If you found this information helpful, don't forget to like and subscribe for more natural health insights. See you in the next video.